നന്മരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. സ്നേഹരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. നന്മരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. സ്നേഹരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. ബുദ്ധിയും വിശുദ്ധിയും സ്വഭാവശുദ്ധിയും ഭക്തിയും വിവേകവും തരേണമേ ദയാനിധി. ബുദ്ധിയും വിശുദ്ധിയും സ്വഭാവശുദ്ധിയും ഭക്തിയും വിവേകവും തരേണമേ ദയാനിധി. നന്മരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. സ്നേഹരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. ഈ കലാലയം നമുക്കു നിത്യവും വസിച്ചിടാം. എത്രയും മനോജ്ഞമായി സ്വഗേഹമായി ഭവിക്കണം. ഈ കലാലയം നമുക്കു നിത്യവും വസിച്ചിടാം. എത്രയും മനോജ്ഞമായി സ്വഗേഹമായി ഭവിക്കണം. നന്മരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം. സ്നേഹരൂപിയായ ദൈവമേ നിനക്കു വന്ദനം.
Thank you, everyone. Before moving forward, I humbly request you to mute your mic. If you have any queries, please inbox in chat box. After the talk by the resource person, there will be a discussion time, and that time you can clarify your queries. This program will be recorded and will be uploaded in the college official YouTube channel. The link will be shared through the Indepth WhatsApp group. Feedback form only share at the end of the meeting. Only those who submit the feedback form will receive the e-certificate through the email ID which you have entered in your feedback form. I humbly request to everyone, kindly follow the instructions for the smooth conduct of the meeting. Kindly cooperate. Thank you. May I now invite Ms. Megha Suraj Koshi, Research Scholar, Indepth Training College, for the welcome address. Over to Megha.
Thank you, Pavitra. Am I audible?
Yes, yes.
Yes, okay. Good evening, everyone. Respected principal, distinguished guests, respected teachers of the college, and all those who have joined us from other esteemed institutions, fellow research scholars, and dear teacher trainees. Welcome everyone to another enlightening session of the Insight Indepth talk series hosted by Indepth Training College, Trivandrum. This is the 59th of the series, and today we have Ms. Aarsha Gopan SG with her insights on the learning disability, know the science and how to help. With a thankful heart, I welcome Dr. K.Y. Benedict, principal of our college, for his unceasing support, guidance, and for the great leadership. A hearty welcome to you, sir, to this online talk series.
Thank you.
I am excited to welcome our speaker for the day, Ms. Aarsha Gopan SG. She is a clinical psychologist. Today, she will be speaking on learning disability, its symptoms, and the ways to tackle it. Ma'am, we are happy to have at the Insight Indepth series. On the behalf of everyone online, I extend a warm welcome to you, ma'am.
Thank you.
A warm welcome to Dr. Bindu B, the research coordinator of Indepth Training College. We are thankful to you, ma'am, for always be on our side with your kind suggestions. I extend a hearty welcome to our dear teachers from Indepth Training College and those who have joined with us from other institutions. Finally, an exuberant welcome once again to all those who have joined us online through Google Meet. Thank you all.
Thank you, Megha ma'am. Our topic of today is learning disability, know the science and how to help. It is a great pleasure to invite Aarsha Gopan SD, the psychologist, as our resource person. For knowing more about the resource person, let us invite Mrs. Soumya Tom for introducing the guest. Over to Soumya Tom.
Thank you, Pavitra ma'am. Good evening to all. I would like to introduce the great eminent resource person of today's Insight Indepth Talk series, Dr. Aarsha Gopan SJ, one of the renowned passionate psychologists. She has done her post-graduation from K College, Mannanam. After that, she worked as a psychologist in Central Hospital, Koothatukulam, also worked as a student counselor. Presently working in Trivandrum Research Clinic and Valmiki Speech and Language Dimension Clinic as a clinical psychologist. Today, we are extremely elated to have Dr. Aarsha Gopan SG with us. She will be sharing her thoughts on a learning disability, know the science, and how to help. Thank you. Thank you.
Thank you,
Thank you
Soumya
so
ma'am.
much.
Let us invite Aarsha ma'am for giving a grateful thought. Thank you.
Yeah, thank you. And first of all, I hope Soumya Tom has left the meeting, right? Okay, anyways, actually, I'm not a doctor. Just call me Aarsha. Okay, not a doctor. So, may I share my screen?
Dear participants, kindly mute your mic. Thank you.
Hello?
Yes, ma'am, it's visible.
Yeah, okay. So, okay. Have you heard about learning disability? Actually, it's an interactive session, so I need an response. So, first of all, I need a response. What is, have you heard about learning disability?
Yes,
Anyone,
ma'am.
please?
Yes, ma'am.
Yes. Yeah. Okay. Can you say,
It's
yeah.
it's a neurological disorder.
Mm-hmm.
It's,
Okay. No issue. This is
it
not an
causes
exam.
a
Just, okay.
genetic problem.
Mm-hmm.
Learning disability is a reading disorder and writing disorder and
Okay.
mathematical disorder.
Okay.
It's causes soda errors.
Sorry, process?
Soda errors, substitution,
Fine.
omission.
Okay. Okay.
Hello, ma'am. Good evening.
Good evening.
Yes, Rahul Deep here.
Okay.
Can I say something about learning disability?
Yeah, sure.
Yeah. Thank you, ma'am. Thanks, ma'am, for giving me
Yeah.
this opportunity. Actually, learning disability, no doubt, is a genetic disorder, and dyslexia, dyscalculia, all are the part of learning disability.
Yes.
As we all know very well about that, and body balancing is also part in learning disability to maintain our body balance, and which is totally controlled by our brain. So I think this is genetic and plus genetic disorder, and also related with brain. That
Yeah.
is. Thank you, ma'am.
Yeah, that's why we are defining learning disability as a neurological disorder. Okay. Yeah. Actually, nowadays this is very common, I think, but at least for teaching professionals have to get
proper awareness regarding learning disability, how to differentiate learning disability from academic backwardness or slow learner students, because someone misunderstood these terms or these symptoms, like student with those who have a problem with writing. So teacher diagnosis, oh, he has some learning disability issues. Maybe it's not a learning disability problem. Maybe he's a slow learner or a academic backward student. So I hope my presentation will give you a minimum information in learning disability, and will help you to for your future career. Okay, okay, come then let's start. Okay,
Okay.
yeah, I'm planning to discuss. Uh, hope you see my. Hope is visible. My screen is visible, right?
Yes, ma'am.
Yeah. Contents: learning disability, types of learning disability, causes of learning disability, signs of learning disability, how is learning disability is identified, intervention and support options for learning disability, facts and myths regarding learning disability. This is mainly I'm discussing. Okay,
Okay.
directly go to the slide. So, what is learning disability? Someone says that is a neurological disorder, genetical disorder, so and so. Scientifically, we can define learning disability. It is a disability in neurological condition. Is a disability is a neurological condition which affects the brain's ability to send, receive, and process information. A child with a learning disability may have difficulties in reading, writing, speaking, listening, understanding mathematical concepts, and with general comprehensions. And actually, this is not only caused by the genetic reasons, there are many reasons. And if in yours, I think someone of you have experience with the students or teaching experience. This is very common. See, when we go through classes, some students have the inability to read, or they are inability to write, or they are inability to process information. Someone is inability to identify or inability to recognize the social cues, our body postures, gestures, voice tones, so and so. And some teachers will punish them because they are the hyperactive students, or they are irresponsible student, like. And first of all, we have to identify what is learning disability and what is ADHD. Actually, there are many problems in child secretary, that ADHD, attention deficit hyperactivity disorder, then academic backwardness, slow learners, learning disability, autism spectrum disorder, like. But many of the teachers directly diagnosis is teacher, ma'am. Some cases I handle that, ma'am. Some teachers says that, ma'am, he has some learning disability issues, because they are not aware about this basic of a learning disability. Actually, no, all academic issues of a child is not a learning disability. There are some specific cases. So, what learning disabilities are not? Some children begin as slow learners, but eventually able to learn and cope with their studies and other activities. Some children may not be interested in specific types of learning, like learning new language, specific activity, skill, or academic subjects, or may not be interested in sports or other outdoor activities. These attributes indicate the child's interest and are not indicative of a learning disability. Actually, we all commonly teachers and academic professionals, teaching professionals are categorize these students as, have some learning disability. They are labeled them as a learning disability. But actually, this is not, maybe that was not a learning disability, because the interest of a student is also a part of the academic. So these are the so all that learning issues are not learning disabilities. And when we comes to types of learning disability, it's very common. Dyslexia.
Excuse me, ma'am. The
Yeah.
slide is not moving. Slide.
Okay. Wait. Okay. Is it visible?
Yes, yes, ma'am. Dyslexia slide.
Yeah, okay. So dyslexia. Okay, dyslexia. Simply, we can say dyslexia affects reading and related language-based processing skills. Uh, Dyslexia is a language. Oh, sorry. Dyslexia is a language processing disorder that impacts reading, writing, and comprehension. Dyslexics may exhibit difficulty decoding words or with phonic awareness. Identifying individual sounds within words, dyslexia often goes diagnosed for many years and often results in trouble with reading, grammar, reading comprehension, and other language skills. I hope you get this concept, right? Dyslexia. Basically, we can simply define the dyslexia is affects reading and related language-based processing skill. This is dyslexia. Then dysgraphia. You can see in the screen the dysgraphic students, right? Like this, mainly H, G, Y. So,
Not visible, ma'am.
why? Is it okay?
No, ma'am.
Is it?
Yes, 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 ma'am.
Okay.
Oh, fine, okay. Okay. Like dyslexia, we can simply define this dysgraphia is affects a person's handwriting ability and fine motor skills. Those with dysgraphia have trouble converting their thoughts into writing or drawing. Poor handwriting is a hallmark of dysgraphics, but is far from the only symptom. Sufferers struggle to translate their thoughts into writing, whether in spelling, grammar, vocabulary, critical thinking, or memory. Individuals with dysgraphics may exhibit difficulty with letter spacing, poor motor planning, and spatial awareness, and trouble thinking and writing simultaneously. 2 years back, I was working as a students' council at a prominent school in our town or in our city. A teacher came to me and she says that, teacher, one of my student has many issues, and actually he writes P into B and 5 into S or S into 5, 3E. He's very much confused with this. Can you help us, please? So I met that child. Through the 1 hour session, I diagnosed that she has some writing problem. This is dysgraphic because
Please unmute. Please, dear participants. Please mute your mic.
okay, thank you. So, commonly we see in these types of students in classes, that is dysgraphia. Okay, then dyscalculia. Basically, this is affecting a person's ability to understand numbers and learn maths facts. This, I think, this is very much common in schools because many students facing these issues with maths. The one of the factor for this issue is the interest towards the subject, and also some students have dyscalculia issues. So dyscalculia encompasses learning disabilities related to mathematical calculations. Individuals with dyscalculia struggles with math concepts, numbers, and reasoning, sometimes referred to as having math dyslexia. Individuals might have difficulty reading clocks to tell time, counting money, identifying patterns, remembering math facts, and solving mental math. These are the problems faced by this dyscalculia. And next, and I think these are the three common uh, learning disabilities, that dyslexia, dysgraphia, and dyscalculia. And Apart from these three, there's other problems like auditory processing disorder. Affects a person's ability to processing sounds, and so individuals with APD may confuse the order of sounds or be unable to filter different sounds like a teacher's voice versus background noise. In APD, the brain misinterprets the information received and processed from the ear. This is actually happened to auditory processing disorder child. Okay. Language processing disorder. It affects a person's ability to process language. A subset of auditory processing disorder, language processing disorder, arises when an individual has specific challenges in processing spoken language, impacting both receptive and expressive language. According to Learning Disabilities Association of America, in language processing disorder, there is a difficulty in attaching meaning to sound groups that form words, sentences, and stories. This is called LPD, language processing disorder. And other common learning disabilities, non-verbal learning disability, NVLD. And this is basically these people or this person or these students is inability to identify non-verbal cues or social cues. They can't understand the body gestures or the tone variation of sounds and all. While it may sounds like non-verbal learning disabilities related to an individual's inability to speak, it actually refers to a difficulty in decoding non-verbal behavior or social cues. NVLD struggles with understanding body language, facial expression, and tone of voice, or the non-verbal aspects of communication. They are unable to understand the non-verbal aspects of communication. This is the main issues. And then visual perceptual or visual motor deficit. These suffered people affects a person's ability to eye-hand coordination. If we can hold a pencil with our 3 fingers, and we can, when we are writing, we can move our eyes behind the pencil. But these people can't because they have poor eye-hand coordination. Individuals with visual perceptual or visual motor deficit exhibits poor eye-hand coordination, often loses their places when reading, and have difficulty with pencils, crayons, glues, scissors, and other fine motor activities. They may also confuse similar looking letters, have trouble navigating their surroundings, or demonstrate unusual eye activity when reading or completing assignments. And so, am I audible?
Yes, ma'am. Yes.
Okay.
Yes, ma'am.
Hope you understand the types of learning disabilities, right?
Yes, ma'am.
Yes, ma'am.
Sure, sure. Okay. Then next we are moving to causes of learning disability. I think 1 or 2 people respond that the learning disability is due to genetical issues. Yes, of course, it's a problem of genetical issues. For example, okay, there is no single specific cause for learning disabilities. However, there are some factors that could cause a learning disability. Heredity. It is observed that a child whose parents have had a learning disability is likely to develop the same disorder. And illness during and after the birth. Any illness or injury during or after birth may cause learning disabilities. Other possible factors could be drug or alcohol consumption during pregnancy, physical trauma, poor growth in uterus, low birth weight, and premature or prolonged labor. Like alcohol consumption or drug consumption during pregnancy period is the reason, and physical trauma, poor growth in uterus.
Excuse me, ma'am.
Yeah.
Ma'am, the slide is not moving.
Sorry. Hello. Sorry, I can't hear you.
Excuse me, ma'am. The slides are not moving, ma'am. Ma'am, can you please make it in slideshow mode, ma'am?
Yes. Actually, it is in slideshow mode. Can you see me?
Yes, ma'am.
Yes, ma'am. Now, causes of learning disabilities, that slide is there, but it is not in the slideshow mode, ma'am. If possible, please. Thank you.
Madam, there is on the bottom taskbar, right side, there is a funnel sized icon is there. A funnel sized icon on the bottom taskbar. Go to the right side and click on that funnel sized icon so that it will be directly converted to the slideshow mode. Shortcut.
Okay, wait.
Or ma'am, just press F5 so that it will start from the beginning. Or shift plus F5 on the keyboard.
Nothing works.
From the current slide, what is the shortcut?
Shift plus F5.
Can you see anything?
F5.
Yeah. Is it visible?
Yes, visible.
Which red process of learning, right?
Causes of learning
Yes,
disability
ma'am.
is there, but it is not in the slideshow mode, ma'am. Just press these two buttons together. Shift plus F5.
Yes. Nothing was. Wait. Let me check.
I think that you have to move the cursor first. Cursor is kept on the file or some other icon on the left top. So you move the cursor and then place the cursor on the slide figure and then shift the buttons.
Aarsha ma'am, can you hear me?
Aarsha ma'am,
Hello.
Yeah. Wait.
No problem, ma'am. Actually, can you see the notes comments on the screen? That's in the bottom of the screen.
Yes.
So after the comment, so there is a cursor, the third cursor, fourth one. After the comments, can you see the notes, comments?
Yeah. Message,
Yeah. After
right?
the comments, there's a logo, and after that, that's a fourth one. That's a plus and minus before.
Wait. Let me
Plus and
check.
minus.
Let me check. One second.
Yeah. No problem, ma'am. You can continue, please. It's okay.
Is it visible?
Yes, ma'am. Visible.
And is it moving? Hello? Okay. Then when it comes to the third causes of learning is, am I audible, right? Hello?
Yes, ma'am.
Yes,
Audible.
you
Yeah,
are
okay.
audible. You can
Oh, fine.
continue, please.
Okay. Stress during infancy. It's a stressful incident after birth.
Yes,
That is high. Yes. Okay. High fever, head injury, or poor nutrition. This will also cause learning disabilities. Then environment, increased exposure to toxins such as lead in paint, ceramics, and toys. Then comorbidity. Comorbidity means associate with other, that children with learning disabilities are at a higher than average risk for attention problems or disruptive behavior disorders. Up to 20% of children with reading disorders also have ADHD. ADHD is attention deficit hyperactivity disorder. Conversely, it is estimated that between 15 and 30% of children diagnosed with ADHD having a learning disability. So these are the causes of learning disability. And then signs of learning disability. In the normal physiological development, the child is expected to acquire a certain set of basic cognition and motor skills. Any significant delay or gap in the development could be a sign of learning disability. A series of well-researched and proven tests and assessments have to be conducted before diagnosing this condition. And the signs of the learning disability means there is a developmental milestones like speech and first tooth, first cry, birth cry. When any delays happen in these stages like birth cry or rollover and speech delay, these are the signs of these developmental stages, delay in developmental stages, the signs of learning disabilities. And in general, 5% of school age children are affected by learning disabilities. Children with a learning disability may also have ADHD. Okay, then the sites may vary slightly during each stages of childhood. And so there are many tests to diagnose any issues for children, and through that we can identify whether he or she has a learning disability. So the signs in preschool students, the child may have some of these difficulties in preschool, developing speaking skills at normal age 15 to 18 months, when speech is typically develops in children, and pronouncing simple words, recognizing letters and words, learning number, rhymes or songs, concentrating on tasks, follow rules and directions, use fine gross motor to do physical activities. Any difficulty in facing in these 6 to 7 points, these signs, the child has some learning issues or learning disability. Then when it comes to primary school students, the child may have difficulty in connecting letters and sounds, differentiating between similar sounds, words, or similar sounding words or rhyming words, reading spelling or writing accurately, distinguishing right from left, for example, confusing, 25 with 52, B with D, or no, S with 5, and recognizing letters of the alphabets, using correct mathematical symbols for doing maths problem, remembering numbers or facts, learning new skills. A child may be slower than other children of his or her age, memorizing poems or answers, understanding the concept of time, eye-hand coordination, being unable to gauge the distance or speed, thus leading to accidents. Tasks involving fine motor skills, holding pencil, tying shoelace, buttoning shirt, and so on. Keeping track of own possessions like stationary items. These are the primary school learning disabled students facing difficulties. And when we come to middle school, the child may have difficulty in spelling similar words, see, week, usage of prefixes and suffixes. Then reading aloud, writing assignments, solving word problems in maths. The child may avoid doing tasks involving stuff. Handwriting, memorizing or recalling facts, understanding body language and facial expressions, showing appropriate emotional reaction in a learning environment. The child may behave in an aggressive or rebellious way and react with an excess of emotion. And in high school students, the child may have difficulty in spelling words accurately, reading and writing tasks, summarizing and paraphrasing, answering application problems and questions in tests, poor memory, adjusting to new surroundings, understanding abstract concepts, focusing consistently, the child may lack concentration on some tasks while focusing excessively on others. Then, while the children with learning disabilities have difficulties in some areas of learning, they also have great aptitude, skills, and talent in other areas of their interest. Most often, we focus on the disorder and neglect the child's talents or skill. It is important that parents and teachers recognize this hidden potential and encourage the child to pursue them. In our then next to how learning disability is identified. Identifying a learning disability is a complex process. The first step is to rule out vision, hearing, and developmental issues that can overshadow the underlying learning disability. Once these tests are completed, a learning disability is identified using psychoeducation assessment, which includes academic achievement testing along with a measure of intellectual capability. This test helps determine if there is any significant discrepancies between a child's potential and performance capability, IQ, and the child's academic achievement, school performance. This is how the learning disability is identified. And interventions and supporting options for learning disability. A learning disability cannot be cured. However, with timely intervention and support, children with learning disabilities can be successful in school. Parents and teachers are the first persons to notice that the child is finding difficulty to read, write, or learn. If you think that your child may have a learning disability, seek help from a mental health expert or other trained specialists for the required intervention programs or therapies. These mental health experts like psychologists, counselors, special educators. Early detection can help the child benefit from treatment or therapy. Neglecting the condition may affect the child's ability to cope with this condition. And if a child has a learning disorder, the child's doctor or school might recommend extra help. A reading specialist or other trained professionals can teach your child techniques to improve his or her academic skills. Tutors can also teach children organization and study skills. Individualized, individualized education program, IEP. A child's school or a special educator might develop an IEP that will describe how a child can best learn in school. Then therapy. Depending on the learning disorder, some children might benefit from therapy. For example, speech therapy can help children who have language disabilities. Occupational therapy might have improved the motor skills of a child who has writing problems. Then complementary or alternative therapy. Research shows that alternative therapies like music, art, dance can benefit children with learning disabilities. Parents and experts need to set goals and assess if the child is improving with the selected mode of intervention and support. If not, alternative methods can be chosen to help the child. So then when we comes to facts and myths regarding learning disability, there are many issues. With all learning disabilities are same. And the fact is, learning disabilities is a complicated condition which includes a group of disorders such as dyslexia, dysgraphia, dyscalculia, and dyspraxia. The severity of the disorder and its symptoms may vary from person to person. So, all learning disabilities are not same. And another myth is children with learning disabilities have low IQ. Learning disability is a neurological condition and hence is not a sign of low intelligence. In fact, children with learning disabilities have an average and above average intelligence. Then the other myth is all learning disabilities are cured by adulthood. No, with a few expectations, learning disability cannot be cured. This does not mean that such children will not be successful. With the right support, children can learn to work around difficulties and use their strengths to achieve their goals in life. And the other myth, the child with learning disability are lazy. These are the very common myths around common people. And the fact is, children with learning disabilities work harder, but their effort do not bring out the results required. Due to this reason, children may become discouraged and appear to be lazy. Then the other myth is learning disabilities and ADHD often coexist. It is true that nearly 1/3 of the children with learning disabilities also have ADHD. Thank you.
Thank you, Aarsha ma'am.
Yeah.
Thank you, dear participants. Have any queries? This is a time to clarify your doubts and give suggestions.
Yes, ma'am. Hello?
Hello.
Yes,
Hello?
audible.
Madam, I'm Dr. Wasif. Thank you very much for the good and not good, but excellent presentation and the new information that you gave us. In fact, just a clarification, we find sometimes children in the 4th or 5th grade, and when they pronounce the words, we find difficulty in understanding them. And this causes a disability for them in the classroom, that the teacher doesn't understand what do they asking about if they do not understand anything. So is there a way or a method or a procedure that the teacher can do or the family, the parents can do to improve their pronunciation, to be clear that anyone who hears them understands what do they want? Thank you.
Hi, Wasif. Actually, I can't understand. What are you trying to say? Can you please message it? Because here the network is unstable, so I can hear you properly. Can you please
repeat again?
Yeah.
In the classroom, we find at school, we find some students in the fourth or fifth grade, when they pronounce the letters, the words, pronounce the words in the classroom, if they do not understand anything or something from what the teacher explains in the classroom in a certain material, if those students who do not understand a certain point, they raise their hand and ask a question, ask the teacher a question. Now, because of their disability in pronouncing the words, the teacher doesn't know what are the students asking about. Now, is there a way to improve those students who find difficulty in pronouncing the words or the sounds in the classroom, to make them clear when they speak, to communicate easily with other people?
Okay, first of all, we
This
have
is
to
the
identify is that that a specific student or that children has any speech inability or speech disorders, or like any speech issues, speech related issues. If he has no issues, maybe because hello, am I audible?
Yes, madam, yes.
Aarsha ma'am? Ma'am, are you there? Aarsha ma'am?
Hello.
Yes, ma'am. Yes, ma'am.
Yeah. Am I audible?
Yes, ma'am. Please continue. Ma'am, Aarsha ma'am.
Hello. Okay, Vasif
Yes,
sir.
ma'am.
First of all, we have to analyze
ma'am. We're listening.
those students have any speech issues. Okay. Like a childhood apraxia or of speech, or speech sound disorders, or like that. How to identify? First of all, we have to identify the language or speaking issues. Hello.
Yes, ma'am. I think there is some network problems.
Okay. I hope he got the answer. Actually, I can't hear him clearly because here the network is unstable.
Okay, ma'am, no problem. Have any other questions or any
Sorry,
suggestions?
I think Pavitra, your sound is breaking. Hello.
Okay, ma'am, here also some network issues.
Yeah.
Have any queries, dear participants? If not,
Am I audible? Hello, am I
yes, sir,
audible?
yes, sir. Yes, sir, please
Dear
continue,
ma'am,
sir.
dear Aarsha ma'am, thank you very much for your presentation.
Thank you.
I am an English teacher and I am a teacher educator also as associate professor from Nvld Training College, Dr. Joju here. And I have done my PhD on slow learners, ma'am. That was slow learners were my sample. And you were telling that to Wasaf sir, if it is a kind of learning disability that need to be treated, if it is an ordinary speech disorder, drilling or training can be given. Am I right?
Yeah.
Yeah, ma'am, I would like to ask about something else. Now, usually, psychiatrists say that learning disability, all those things are related to um, uh, brain disorders, and teachers do not have any role in it. And so there is a need of medicine and such chemical intervention is required. Is that true? What's your opinion? Is there a scope for teachers to deal with learning disability, and if possible, up to what level?
So basically, uh, in my opinion, this the chemical imbalance in brain also leads to learning disability or neurological or developmental issues. But for a teacher, they can support the students. First of all, already I told you that teachers have the awareness to identify a learning disabled or a slow learner or academic backward children, so that they can support to the students how to achieve the success. Because in our system, education system, actually teachers are unaware what is learning disability or what is so and so. Through this, they are labeled, these students are, in Malayalam, usually in our schools, പഠിക്കാത്ത കൊച്ചു ഒന്നും പഠിക്കില്ല. So they are labeled and dump them to a corner. But maybe due to the difficulties like learning disability or anything like that, that is the reason why they are less scored in academics. So the teachers have to identify the problem areas and support them to overcome their difficulties through supporting them or through give a special care to them or personal care to them. So teachers can do, in my opinion. And if needed, actually the people, maybe parents are unaware about. If we are asking that, ma'am, your son has this problem, this dyslexia or dysgraphia, oh no, actually they are not ready to accept what is the issue. No ma'am, my son, oh my god, this was a response from the parents. So we the teachers has the influence to have to influence the parents to aware them about what is happening to their son or daughter. Is it a learning disability, whatever? So yeah, teachers can do many things like managing the to support prompt, verbal prompt or writing. If those who have writing issues, they prompt them to write specific letters, and they can give special cares to the students, those who need it.
Thank you very much, ma'am, for that answer. In my experience with the slow learners too, I felt the same. Um, I felt that mainly slow learning can be related to the mental capacity of the child. But I felt that nutrition, parental care, teachers' care, and psychological stock can be very effective in enabling the slow learners to become natural learners. That's my experience also, ma'am. Thank you, ma'am.
Yeah, thank you, sir.
Thank you, sir. Thank you, Aarsha ma'am. If any other queries?
Congratulations, Aarsha, for your wonderful presentation. Within a short span of time, you have made a very good coverage of the topic, giving a lot of clarifications to the suggestions and questions raised by the audience also. Could you please elaborate something on the possibility of the support mechanisms that are available in our region for the benefit of all those who have assembled here?
Thank you, sir. Thank you for the question. And mainly, there are many the clubs, clinics to support the learning disability of slow learner students. So, in my opinion, I think every school need a special educator for support these types of students, because there is no special school for learning disabilities or slow learners. They are studied in with common other normal students. So actually, they are struggling to achieve or to walk with the normal students. So we need a special educator in every school so that they can understand, they can help the students, those who need it. And and also there is I think there are less number of these supporting clinics and intervention clinics for learning disability and speech therapists, and that's a fact. Then on the other side, our parents, they are not ready to treat, or they are not ready to accept the truth that the student that the specific child has this issue. If they are ready to accept, let's give some interventions, but we can't. As a psychologist, in my experience, we can't do anything. In some time we will become helpless. Yeah.
Thank you, Aarsha ma'am. Vendik sir, can we move forward? Bindu ma'am?
Yes, we can.
Okay, Pavitra. Okay, thank you very much, Aarsha ma'am, for your enriching session. Pavitra?
Yes, ma'am.
Okay, we can move.
It's time to express gratitude. And for that, let us invite Akansha Prajapati for expressing vote of thanks.
Thank you, Pavitra ma'am. Am I audible?
Yes, ma'am. Yes.
Okay. A very warm good evening to everyone present here. Respected Principal Dr. K.Y. Bendik sir, our research coordinator Dr. Bindu ma'am, our most valued invited guest of the day, Mrs. Aarsha Gopan SG ma'am, all teachers and research guides who have joined us for this meet, ladies and gentlemen. First of all, let me express my sincere gratitude to our resource person, Mrs. Aarsha Gopan SG ma'am, who spared her precious time to grace this occasion and enlighten all of us with a rather important but less discussed topic on learning disabilities, its signs and how to help. Thank you so much, ma'am. You have widened our perspective on the topic. Thank you once again.
Thank you. Thank you so much.
Next, I would like to extend my hearty thanks to our principal, Dr. K.Y. Bendik sir, who has been a pillar of support to the research wing of Madhya Phyllis Training College through his unending motivation and guidance. Thank you very much, sir. Such an event would not have happened without the unstinting support of our research coordinator, Dr. Bindu ma'am. Thank you very much, ma'am. I would also like to express my sincere thanks to Dr. Ainsi ma'am for providing all the technical support. Thank you, ma'am. Let me also express my gratitude to all the teachers, research guides, and scholars and participants who have joined us today on this virtual platform to make this event a successful one. Thank you, one and all. Thank you.
Thank you, Akanksha ma'am. Dear participants, please fill the feedback form that will share in the chat box. These certificates will be issued in your email ID, which you have entered in the feedback form. Thank you so much for your valuable participation. Please join with us on next session of Insight Indepth Invited Talk series. Thank you so much. May God bless you all. Stay safe. Thank you once again. Now, we come to the
a special announcement. Pavitra, 1 minute. All the
yes.
research scholars of Martha Phillips Training College and research guides and teachers, you are requested to be stay on the line for a few minutes before the national anthem. Meanwhile, other participants fill up the feedback form. We will have an interaction with Dr. V. Rehusa, who will give us some insightful discussion on the international conference that we are going to organize on 3rd, 4th and 5th of March 2022 through online mode by the Martha Phillips Training College. Sir?
Yes. Okay. Well, thank you, Principal, respected Principal, research scholars, and friends. I think all of us are aware that we have planned an international conference online from 3rd to 5th March. I would like to show you the transparencies so that it will be in your memory. So it is an international program. The main theme is incremental changes in instructional strategies and research in higher education. March 3rd to 5th, 3 days. That is Thursday, Friday, and Saturday. And we have some 5-6 sub-themes. First one is blended learning, teaching innovations, national education program, education policy, national NEP, National Education Policy 2020, changes in teacher education program. We know it is going to be changed to 4 years, integrated teacher education. Third one, trends and priorities in educational research. All of you are doing your PhD program and you may be doing something innovative aspect. So you can also participate in the program. There is a specific area aiming at research scholars, that is trends and priorities in educational research. You are doing a piece of research in the area of education. So it is the right time for you to share with others. 4, vocational education, problems and possibilities. 5, emerging trends in the management of school education and higher education. A lot of changes are taking place as a result of the program. Then emerging trends in the management of school education that I have explained. Then lifelong learning, which is a major focus of UN bodies. And 7, inclusive education. So these are the major areas. Now we would like to request all the research scholars to present a paper in the program, because you are doing something innovative. Let others be aware about it. So you are getting an international group representing all Indian states and many foreign countries, research scholars, academicians, teachers, and many other researchers at international level are participating in the program. So you can also participate in the program. We can present papers and you can be a part of the program. Now there is a special competition for different target groups. I think you can see the transparency. Am I audible? Hello?
Yes, sir.
Okay.
Yes, sir, audible.
Paper presentation competitions will be conducted as a part of the program. There are different areas. First one is for DLED students, Diploma in Elementary Education students. The topic is teaching learning in school education. Second group is for B.Ed students on the topic blended learning in school education. Third is M.Ed students. Topic is National Education Policy 2020. And fourth group is yours, research scholars. Topic emerging trends in educational research. All of you are doing research in education. You'll be doing some innovative aspect. We can take some part of that with the permission of your research guide, and you can present it in the international program so that others will get an idea about your program. Sometimes you may get very good feedback about your research program. Anyhow, as a part of the program, you are supposed to present papers in seminars, because when you submit your thesis, there will be a question from the university, how many papers you have presented. So this is the right time for you. Martha Village Training College is organizing this program, so you can also participate in the program. And the fifth group is for teachers, school age teachers as well as college teachers. Topic is education for sustainable development. So these are the competitions, and you can also participate in the program. Now we have invited many international agencies to participate in the program, and not less than 6 to 7 agencies are collaborating. All India Association for Educational Research with headquarters at Bhubaneswar, they are collaborating. It's a national body, focusing on educational research alone. Then Indian Adult Education Association, New Delhi, Indian Adult Education Association, New Delhi, they are also collaborating. Council for Teacher Education Foundation at national level, with special focus on Kerala. Then ARIO, Association of International Researchers of Indian Origin. Then comes Living Lab from New York. Then our own collaboration, UN, Academic Impact. Like that, 7 agencies at a national and international level are collaborating with our program. So this is the right time for you to show your, research capacities and capabilities in a very interesting manner. So I would like to share these basic thoughts with you. If you have any question, you are free to raise. Any clarifications, you are welcome. And we have fixed a small registration fee. The Kerala Higher Education Council, Government of Kerala, they are also collaborating. So you will get a certificate. It will be sent by post, not an e-certificate, a printed certificate will be given, which will be signed by Kerala Higher Education Council, by Government of Kerala and other national and international agencies. So this is a rare opportunity for you to share your thoughts in educational research, your topic, or something related to your topic. So that's in brief. Remember, the dates are 3rd to 5th March 2020. So we have roughly some 17 working days. 17 working days. You have time to prepare, and you can submit a abstract of your paper in 100 words. All those things were already in your site. You can see details, and you have to submit your paper on or before full text by 20th of this month. So you have those who are doing research, they have enough time to do it. So this is the information we would like to share with you. I think all of you are aware. We are just reminding you, so you can make use of this rare opportunity to present a paper in the program, because it is organized by our own college. Once in 5 years, our college will be organizing such programs. And this is a rare opportunity for you. Next year, we don't have. Very limited colleges are doing such wonderful program. So we need your cooperation and support in the successful organization of the program. That's all from our side. Now, if you have any questions, any suggestions, any queries, you are welcome. Thank you for your patient listening. Yes.
Hello.
Yes.
Hello, sir. Sir, it is an offline program and
Yeah.
online program.
It is an online program because of the
How
COVID
many
scenario.
pages we need? How many pages we need for this presentation?
Yeah, your abstract. Your abstract can be around 100 words. Abstract.
What's my?
Your full text can be. Your full text can be 1,200 to 1,500 words in A4 size paper.
Okay. Already we have visited some colleges in Mahatma College, sir.
Yeah.
I know, sir. In Ernakulam itself, my MA. I was doing my MA with my professor. We visited that college, sir.
That's fine.
That program is very useful for us.
Yeah.
That's why I want to do something for this.
You are welcome. You have time. You can submit your abstract around 100 words this week. And you can present your full text before 20th of this month.
Okay, February. Can I, sir, how can I present this, sir? Through sources?
Yeah, you can send it. It is available in the mail. In our college website, it is available. It is the information was shared with your research. Your site.
One sec, sir. We can search our
you
our
can see
own.
That. Or we can do it again. It's not a problem. That is available in the college website. All the details are given. The email ID, the details of the program, timing, everything is given. You will get around 12 minutes for presentation. You can present for 8 minutes and another 4 minutes for discussion.
Okay. Through PowerPoint or manual?
According to you. We prefer that you present through PowerPoint so that it is visible for the international community. Okay.
Which one is easy for me? We can present, right?
Better you use your PowerPoint skill so that others can,
Option is ours, right?
Okay.
Oh, thank you, sir. Thank you, sir.
Welcome.
Ma'am, are you in Insight Indepth group? Are you in Insight Indepth group?
Yes, sir. Yes, sir. Yes, sir.
We will give the details in our 5 Insight Indepth groups also.
Sir, can we send it through my mail? You can?
No, ma'am. Directly, you will be viewing all the details in our Martha Villas Training College website, and in the Insight Indepth groups also we will provide.
From the program file itself, you can directly join the seminar group and do the registration either in the Telegram group, and then after completing the registration procedure, you will be directed to move to the seminar WhatsApp group so that further details will be communicated in the WhatsApp group for you. So it will take only 5 minutes for you to do all these things.
Okay, we can add me in our WhatsApp group.
First of all, you have to visit the brochure or the website, and then the link could be used to initial registration, and then you will be automatically directed to the group. So further details you can get from the group.
Okay. I will try, sir. I will try to. My level best. Okay.
Thank you, madam.
Okay, thank you.
From which institute that you are attending, madam?
Sir, I'm doing my MRD in St. John's College of Education. Tamil Nadu, sir. Veeravnallur, near to Seran Mahadevi. You know that place?
Which district? Salem?
Salem, not Salem, sir. Tirunelveli.
Tirunelveli. Okay. Welcome. Convey to your friends and colleagues too.
Sir?
Convey the message to your friends and colleagues too, so that you can come as a group.
Sure, sir. Already I have visited visited that college of Marthoma Arts and Science College, near Ernakulam.
Yes.
Okay.
Yeah, we were there for a program.
Okay. We have attended 3 days program. We all stayed there with our professor and family.
Years back.
Yes. It's a sweet memories, right?
Okay. Any more observations? Yes. Any more observations? Questions? So once again, I would like to request you to go through the material which will be available in your website, and you can join directly through the website. Yes. Any more questions? Right.
Sir, good evening, sir.
Yeah. Good evening.
Sir, I already attended your meeting, last meeting, sir.
Yeah.
But I can't receive my e-certificate, sir.
Which meeting you are talking about?
Sir, I am also in the same college, St. John's College of Education, Veeravnallur, Tamil Nadu, Tirunelveli district.
Yeah.
But I can't receive my certificate, sir.
Which are organized by whom? Organized by whom?
She may be speaking about the previous Insight Indepth talk that we have conducted.
Yes, sir.
Savita, could you post your mail ID in the chat box? so that Agamsha can note it down immediately. Agamsha, please attend. Savita,
Yes, sir,
note
I'll
down
do that.
your mail ID, please.
Sir, you have
Sure,
Agamsha,
sir.
you already sent one
Agamsha will
certificate.
wait.
Sophia, hello.
Ma'am, kindly post your email ID on the chat box and I'll send you the certificate on that.
Okay, ma'am.
Thank you.
Thank you.
Agamsha will verify the attendance and response list and then will send the certificate.
Okay, sir. Thank you, sir.
Hello, good evening, sir.
Good evening.
This is Josephine from St. John's College of Education, Veeranallur, the same college, sir.
Yes.
Myself too, I have attended last meeting and I have posted everything, but I didn't get the e-certificate, sir.
Okay.
Hello, can you hear me, sir?
Yes.
Ma'am, you're audible.
Directed,
Kindly
you can send
post
your email ID
Yes.
and they will get it. You send your email ID to the chat box.
Okay, sir.
Okay, welcome.
Thank you, sir.
Yes. And now back to the organizers. Hello.
Sir,
Yes.
move forward.
Yeah. Now we can go ahead. Thank
Okay,
you.
sir. Now we come to the end. We close it with National Anthem. Can you please start National Anthem? Thank you, everyone. Thank you, everyone. Thank you, sir. Thank you, teacher. Thank you to all research scholars. Thank you all.
Congratulations, Pavitra, for your maiden attempt of anchoring in the Insight Indepth program after joining the research center. I can appreciate and congratulate you for taking up the
Thank you, sir.
responsibility. Meanwhile, many of the experienced research scholars find meager excuses for avoiding the duties.